that right now. Okay, let me pull up my notes. Okay. So welcome everybody. I am so excited that you are all here to join us today for this presentation on new advocacy strategies for changing policies. I'm particularly excited about our fantastic panel of guests who are with us today, who are experts in policy work and are true insiders to the legislative process. They're here to answer our questions and give us some up-to-date information regarding advocacy and policy work during these crazy times. I'm honored to introduce our speakers. First, I'll start with Elaine Lin. Elaine is a Family Voices of California's Project Leadership Manager. She works with community-based organizations to provide comprehensive advocacy and leadership training to help families of children with special healthcare needs and disabilities move from individual to systems advocacy for health systems improvements. Elaine has 2 children with complex medical needs, and her 17-year-old son has an intellectual and developmental disability. And I'll just add that it's been a pleasure to work with Elaine this year. Our next panelist is Robyn Linscott. She is a policy fellow in U.S. Senator Kamala Harris's office. Robyn spent 8 years as a special education teacher in New York City. Her brother Neil has neurodevelopmental challenges. Robyn focuses on issues related to health, education, labor, and child welfare. I had the pleasure of meeting Robyn in Washington, D.C. last November during the AUCD conference during our legislative visit to Senator Harris's office. And I just have to say, it was the best legislative visit I ever had. Robyn is so knowledgeable and was so patient with all our questions. If anyone can do a legislative visit, I hope they're all like that. So thrilled to have Robyn with us today. Our third speaker is Adriana Ellis. She has worked in California's legislative and public policy arena for almost 2 decades, helping forge policy from key leadership roles, including as a legislative chief of staff, legislative director, and as a policy analyst for state agencies. Before joining the office of Assemblymember James Ramos, Adriana served as the legislative director for Steinberg Institute, nonprofit dedicated to sound public policy in the arena of mental health and substance use disorders, and as a chief of staff for 2 legislators. She also served as a legislative coordinator and analyst for 2 large state agencies. Adriana grew up in Placer County and is a graduate of California State University, Chico. She's married with 3 teenagers and 2 dogs. Thank you for joining us today, Adriana. With that, I'm going to turn that to Elaine Lin, who's going to give us an introduction on the seminar and an overview.
Thank you, Kelly. Good afternoon, everybody. Today, we are going to very briefly review our previous seminars that we have had over the last several months. And as Kelly mentioned, we will we'll get an insider's view of Congress and the California legislature and what business looks like there these days. And we will discuss some of the current issues facing people with neurodevelopmental disorders and intellectual and developmental disabilities. And we will talk about some strategies for advocacy in this changing policy-making environment. So just a quick review on what we have done in the past. Back in November, we talked about public policy advocacy for systems change. We really looked at how to become an effective systems level advocate, so moving from that individual level to that systems level. We talked about disability history and that foundation that we really saw set over decades. And we talked about the importance of continuing that legacy by moving to that systems advocacy. We also explored how to tell your story to impact decision makers and policy making. In our second seminar, which we sort of did, I don't want to say in place of, because nothing can take the place of our annual health summit, but we added that one in because we were unable to continue with the health summit. But that was all around family and professional partnerships and the value of these partnerships in developing policies and practices. We also looked at how to engage families as true and authentic partners using the 4 dimensions of family engagement: representation, transparency, impact, and commitment. We had an overview of the legislative and budget processes and why we should engage in those processes and how to do that. We also talked about the chronic underfunding of the systems serving people with intellectual and neurodevelopmental disabilities and the rate study and budget proposal that at that time was beginning to move through the legislative and budget processes, and specifically how to support those efforts. So we know that life has changed for everybody, and challenges have now compounded for people with NDD and their families and those who serve them. We're kind of all in crisis mode at one extent or another. And I don't know about you, but to me, somehow time seems to simultaneously race and stand still. And we all have these added personal and professional challenges, whether it's work, economic impact, financial burden, caregiving, working, homeschooling, all of those things combined. And there are a lot of competing interests. People with disabilities are hit especially hard when we think about access to distance learning and what that looks like for children and adolescents who receive special education services, uncertainty over educational rights given what we may be looking at in different types of waivers, preparing for health system overwhelm and versus discriminatory care rationing, and thinking about care and protective equipment to support people with NDD, those who need that day-to-day support, as well as, of course, economy and job loss. This affects those families with children and other loved ones with NDD even more so. We're seeing new policies proposed and enacted nearly every day, it seems like, and day-to-day policymaking has absolutely changed. So that's why we're going to hear from some insiders today, Robyn and Adriana. So we'll start off with Robyn.
So it has been, it was a really great honor to be able to meet with Kelly and the rest of the group at the Mind Institute's Linn program in November. As much as Kelly said that it was a great meeting, it was really special for me because as they mentioned in my introduction, the reason that I came into this work is highly personal. My mother was a special education teacher in Newark, New Jersey for 35 years, and she worked mostly with students with autism. And my brother Neil is 28, and he also has autism. And for 8 years, I was a special education teacher in New York City, and I worked at a therapeutic school, and so I really got to see a cross-section of students. We served students from the juvenile justice system, the foster care system, and kind of showed me the way that the education and special education interacts with the healthcare system and with the child welfare system and the justice system, and so many different lanes that come together to form these policies. And I think also in influencing my decision to change from being in the classroom to moving into this policy role was the fact that, you know, I've had this view of special education in particular from kind of all viewpoints as an educator, in seeing, you know, my brother and his experience as a student in the special education system, and then also seeing my mom dually as both a parent and a special educator herself, and kind of seeing that, you know, the difficulties of navigating a system like this, even when you are immersed in it from a professional experience, that it is still such a complicated and crazy system. So that is really what drove me to this work. You know, I miss my babies in the classroom every day, but I'm so happy that I'm able to advocate for them on a bigger scale. So yeah, that is why I came to this work, and that's why, you know, I do what I do every day. So I was also asked how our daily work life has changed, and I think this goes for you know, for a lot of people in this new work from home life. I think ironically, we're working more hours now that we're working at home than we did when we were in the office. Obviously, I think, we are trying to be able to pass legislation that works for California, but also, we're all dealing with this issue of work-life balance, and what does that mean, and how do we differentiate our time between life and work and all of those things. It's that idea of, well, I'm home, so of course I can answer this email at all times of the day. And so that has definitely, definitely changed. I think, again, that goes for everybody who is, we're lucky to be able to work from home, and that's definitely presented its own set of challenges. I think within that context, I think things are taking a lot more time than they had before. And I think part of that is because we can't just pop over a cubicle wall and ask a question. You can't just pop by somebody and be able to kind of hash things out in a way that would probably be most effective face to face. You have to be on the phone with them. You have to schedule a time to call them. You have to email, and that can take the back and forth. And I think our inboxes have kind of exploded, and so I feel like we're spending a little bit more of our day each day going through them and kind of just keeping up with that. But there are some things that haven't changed. The appropriations process and making sure that all the programs that get money appropriated to them, that timeline did not change at all, despite the coronavirus pandemic. In fact, the appropriations projects that my team deals with, the Labor and Health and Human Services, was actually due on the exact same day that CARES was put into the Senate. So that definitely was a little bit of a crazy time for us. So there are some things that, even though we're not physically in the office, from a legislative stance, have not changed at all, and making sure that some of these vital roles that Congress plays are still on the timeline that they need to be. I don't necessarily think that priorities themselves have changed, but I think that everything has obviously shifted into this COVID context. And I think if we're looking for some silver linings out of this, I think some of the issues that we all know have been a significant problem. Obviously, access to health and education for people with disabilities, general health disparities, access to healthcare in general, homework gaps, small business loans, all of those things that we had been fighting for before this. I think they have really been brought to the forefront in this context, and so I think that is a little bit of a silver lining. So some of the things, obviously, that we had been fighting for beforehand, now we just kind of are doing it in this context, with the hope that further down the line, when we kind of get out of this firefighting stage, we might be able to implement longer lasting change and reform for some of those things. I think, again, there's some interesting challenges and advantages in this new normal and this new work from home. As I mentioned before, the kind of work-life balance is really hard. Obviously, this is not unique to me or to the work that we do. I know everybody is dealing with this, and I will be the first one to say my husband and I do not have children, and so that is I can't imagine to all of the parents and families that are caregivers on top of working from home and being with their children. So hats off to all of you. I think that an advantage to this is that I think we've had a little bit of a self-reflective moment, both I think as people and as our Senate office, but I think also as a nation. I think we've all had to kind of look at our priorities and the way that we prioritize things. And on a personal level, I found myself, reaching out to people that I hadn't had as much contact with before. So that's definitely been an advantage. one thing that I actually have really enjoyed is, especially in the past few weeks, being able to schedule kind of phone calls with constituents has actually been a lot easier, because it's really only my schedule that, you know, you need to kind of work around. You don't have the same issues of, you know, we have 2 conference rooms, and so, you know, well, if these other groups are in here, then where are we going to go? That has been really nice. So I think it's actually allowed me to have more flexibility and to be able to also work, you know, work in the time zone differences has actually been a lot easier, being at home as opposed to being in the office. So that has definitely been a bright spot, and allowed me a little bit more connection to groups and constituents. So those are kind of how things have changed, you know, on our end and from our office end. So kind of shifting into this more policy focused section, I was asked to speak a little bit about the issues and actions that people with intellectual and developmental disabilities should be mindful of and advocating for. And obviously, I think in the forefront of everybody's minds are IDEA waivers. I know me and all my other education policy people across the Senate have been, you know, refreshing our phones and our email every 5 seconds, waiting to see, you know, today was the day that we were anticipating Secretary DeVos to release her suggestions for waivers. So that's definitely obviously something that we are waiting for. And I think recognizing that we need to see what comes out of that and what she says before we can, you know, kind of formulate what are the best next steps are going to be. I think regardless of what that is, we need a huge infusion of funding for IDEA. I think, again, speaking to the silver lining, you know, this might be the push that some people in Congress need to recognize that full funding of IDEA is necessary, and it was necessary, you know, 10 years ago, and it was necessary 6 months ago, and it's more than necessary now. So hoping that, you know, this will lead us down a path to hopefully eventually to full funding, if not a huge infusion. Some of the other issues, actually, it was very timely. Last week, Senator Harris signed on to a letter that was sent out by Senators Warren, Casey, Brown, Gillibrand, Hassan, and Duckworth to leadership that outlined some of the specific considerations for people with disabilities that need to be taken into account when creating a 4th relief package. And it listed, I think, about seven or eight priorities. Some of those were paid family leave. So family members who might need to be home to take care of someone with disabilities, obviously they can, you know, they can have paid leave to do that. PPE for people with disabilities. And I think the overarching theme was the protection of civil rights for those with disabilities, and making sure that, you know, we know that there are groups of people that are, you know, potentially more, that are predisposed to having complications from COVID, and making sure that we are doing everything in our power so that everyone's rights are protected. As far as the best way for your voices to be heard and to reach out to us and advocate, I think that letters, when they are sent, if you have a specific staff member that you know in an office that you can send them to, that is super helpful. Sometimes if they're sent to a kind of like either a general email in the office, or if it's sent to someone who is maybe your chief of staff in the office or your legislative director, especially for a state the size of California, sometimes things you know, can get a little bit lost in the crazy inboxes. And so for someone who is kind of looking at the overarching scope of everything, and not necessarily kind of disability or healthcare or education specific things, might take a while to trickle down to whoever that particular staffer. So I would say that if you are sending a kind of large coalition letter, to make sure that if you have a specific staff member that you know works on those issues, to send it directly to them rather than, you know, a higher up in the office per se. And honestly, setting up phone calls with staff members, like I mentioned, I have found it a lot easier to be able to schedule these meetings because we're not vying for space. I'm not, you know, you don't have to kind of compete with it as many meetings and other things going on in the office. And so I think now that things are slowing down a little bit, I think that, you know, a lot of staff members on the Hill have some flexibility in their schedule to get on the phone. As far as schedule and when the Senate is returning to work, the Senate will be convening next Monday, May 4th. We are unsure what that means in actuality as far as staff returning to offices. You know, I think as the week goes on, we're going to find out a little bit more. I think the assumption is that it will be kind of a skeleton crew working through each office, and the majority of staff are going to continue to work from home. We're unsure what it means as far as tours and access for the entire Capitol complex for outside visitors. But the Senate will be convening on Monday afternoon, May 4th. So Senator Harris has been in Washington, D.C. the entire time, so she does not have to fly back from California, but the senators, looks like they all will be coming back into D.C. to start on Monday. So I think those are all of the questions that were posed to me. So I am going to hand it off to Adriana in state office.
Hi, this is Kelly. Just before Adriana starts, thank you so much, Robyn. That was great. And we're doing great on time. So I'm wondering if just while it's still fresh in people's head, perhaps, if anybody has questions for Robyn right now, just a couple, feel free to shoot them to me. Otherwise, we can also go to Adriana. And I'm looking at chat box. So either you can unmute yourself if you have a question or type it in the chat box. Looks like we have a question. Let's see. Do all COVID-19 orders and laws have specific end dates? Oh, Robyn, let me unmute you here. Oh, it's not letting me unmute you. There we go.
All right, I think I'm unmuted now. Sorry. Yes. Is the short answer to that question. So right now, almost all of the education waivers that are that were in the CARES Act for the ESEA, the Elementary and Secondary Education Act, do have an end date for the 2019-2020 school year. So just carrying through that school year. There are a few that are related to it's called the maintenance of effort, which has to do with states maintaining the amount of funding that they provide to school districts that do have some extensions into next school year, just the way for kind of fiscal calendars and whatnot. It is really hard to anticipate as far as IDEA waivers, again, not having seen them, obviously, and still waiting for Secretary DeVos to release those. You know, we do know that any waivers that she recommends will need to be enacted as their own individual piece of legislation by Congress. And so this is really, it's that piece that I think really allows for that advocacy and allows for that narrowing down if what Secretary DeVos comes out with is, you know, far too much flexibility for school districts in this way. When those are again, these are her suggestions. So when those waivers, if they would be passed into law, there would hopefully be a specific timeline. Again, they would probably align it with what the other elementary and secondary waivers were and make it through this school year, but I anticipate that since some of the waivers that I know some people have been advocating for have to do with obviously specific timelines, my guess is that they would need to, and this is my own surmising, that they would need to extend a little bit into the 2020-2021 school year to encompass that, this needs to address once everyone is able to be back in the buildings, and some of those in-person assessments and things like that need to happen. My guess is that it will not be able to just end at this school year. But again, things are so up in the air until we hear what Secretary DeVos comes back with. So.
Great, thank you, Robyn. Yeah, there's a lot we don't know, that's for sure.
Yeah. I know.
I know it. Well, I encourage, thanks for that, Robyn. We're going to move on to Adriana, but just to let you know, if you guys have questions, feel free to, continue to type those in, because we're going to have more time at the end for questions. So both for Robyn, Elaine, and Adriana. Okay, I'm going to move past the mic. Can I say that? Mic, the video square, to Adriana.
Thank you. Thank you so much, both to Kelly and Elaine, for inviting me to be a part of this. I've actually had the opportunity to work with Linn in the past, the UC Mind Institute, as in my capacity with the Steinberg Institute. So I know what you all do, and I'm so pleased to partner with you again. A little bit about me and why I care so much about all of these issues. First of all, having worked in the arena of public policy now for many, many years, more than I care to say how many, although thank you, Kelly, for mentioning that, almost a little bit over 20 years. It's always been an interest of mine, particularly since I am personally someone who's grown up with my own neurological disorder, and so the struggles that have brought me to where I am today, I both appreciate but also recognize as they are real struggle. And watching first my parents and then myself as I navigate the system to get what I need, right? And so I'm so very pleased to still be very involved. So as far as, the next question is how has my daily work been impacted by COVID-19? So as Kelly mentioned in the intro, I have 3 teenagers and my husband and my 3 dogs that are all together home. Every single one of us is staying at home. So that, you can imagine, has lots of challenges. Often it's not a thing that is normal to us. We are both 2 working parents, so that has been a very new normal for us, for all of us to be home. I think our dogs are really out of sorts, wondering what the heck is all this about. They get walked a lot, I'll say. Multiple Zoom meetings going on at the same time, a couple of kids with their schoolwork, my husband, myself. So it is a busy household, while at the same time just also trying to enjoy our time together, which we usually don't get. So I want to be mindful that this is an opportunity for us to be together and to take advantage of that as well. In terms of how we're dealing with it as a public office, I as chief of staff managed 2 offices. I managed the office that is in our state capital here in Sacramento, and I also manage the Assemblymember's office in Rancho Cucamonga, which is in San Bernardino County. That in itself is its own challenges. One, as a manager, you're tasked to provide for your staff what they need in order to do their job, while at the same time being mindful that they are themselves experiencing their own challenges, being mindful of the fact that working from home is actually very difficult. And we don't know everybody's stories. We don't know what challenges they have at home. And yet we still have to perform a duty because we're still very much open to the public, although via virtually. on March 16th, the state capitol closed, both to the public and to us. So that's how long we've all been home. And the challenge for us is that, especially I think for someone like me, my identity of my work life is so connected to the place I work. I work in the state capitol, where there's hearing rooms, there's meetings to go to, there's constituents coming in, there's the media, there's the public. And so it's a very busy environment. It's a very transparent environment in that it's open, completely open. You are not allowed to lock your door, as an example, unless you're having a staff meeting. The constituents are always invited in, and the public is always invited into everything we're doing, whether it's a hearing, a meeting, unless it's a private meeting. So having to shift that has been incredibly difficult. But every day we're figuring out how to make it work, how to still continue to make yourself accessible in whatever way, capacity you can to the public. So those are the challenges. In terms of the next question here is, what are some of the processes that have changed in terms of the calendar, the schedules? That is for us very much dealing, what's been very clear for us is that all of our legislative deadlines were suspended, with the exception of the constitutional deadlines, which for us is the state budget, which has to be passed by June 30th. But all of the other legislative deadlines, meaning our legislative calendar, what the work, the hearings that we do on bills and things like that, have been suspended. So essentially you can imagine that we began the year with all the new ideas, all the new legislative ideas that everybody was bringing to the table, new process, starting to develop a legislative agenda for each office and for the state and for our district, and that all has stopped. That doesn't mean that we have stopped working on our ideas or that we have stopped working on developing those ideas. We just are not moving them forward in terms of having open hearings, having committee hearings, and things of that sort. However, we do expect that the suspended deadlines to come back in some kind of truncated way, and we're still at this point waiting to hear what that is going to look like. That has not completely been determined at this point. But what is important to us and what we have been able to do during this time is to really, I think, an opportunity for all of us to listen to our constituency in a very different way. So kind of the way the state offices of assembly members, and this goes for the Senate as well, of the state, the way it works is we have staff that does the every day-to-day kind of hearings with the legislator when he's in session in Sacramento, so we're there. And then we have our district staff that's in our district that works directly with our constituents. What's happened to us is that we are all working with our constituents, because the number of calls that we receive every day has to some degree tripled, with people needing to know how to even do things like how do they access their local DMV, how do they apply for their EDD, so we're all very much involved with our constituents. And by the way, that is a silver lining. I think it's wonderful. It's a wonderful opportunity to learn more about our constituents and their needs. And so in terms of, I know that question comes up next, like how can you be involved? Call your legislator, call your offices, get to know them. We are open. This is all in the assembly. All 80 offices are open. You can call. You're supposed to get a call back, and if you don't get a call back, insist upon it. This is what you get to do. You get to call us, and we get to talk to you, and it is a wonderful thing because in a lot of ways we have more time for you because we're not inundated with these very hectic hearing schedules. So I would say that that's an advantage to the public, to all of us who are advocates, who are wanting to do things. Some challenges that I see for all of us, not just for those of us who work in policy making, but also just your everyday kind of the needs we have. For example, just filling a prescription, I realized how difficult it actually sometimes can actually be if you can't, your doctor's office isn't open, so they can't, and sometimes depending on what kind of medication you need, they can't just give you a prescription over the phone because you have to be seen. This is a challenge I recently went through. And not all prescriptions are allowed to be given out through just a virtual meeting. They have to be an in-person meeting. I don't know how many of you have come up with this challenge, but or family members that have come up with this challenge. But these are things that we realize now that our state, these regulations that the state puts upon, for example, our physicians, and they don't necessarily work at a time like this crisis we're having. So at the same time, we're trying to regulate how we are prescribing medication, we're also hindering the very people we're trying to help. So this has been an eye-opener, by the way. And when you come upon something like that, where you realize, hey, this doesn't work in an emergency, please be mindful to remind us of that, because this is when we need to see, like, here's our test, right? We're testing all these processes that we have, all these regulations that we have that sometimes are not, they're not actually doing or they're having an unintended consequence. Someone not being able to get the prescription is an example. What are some of the next question, and I'll try to give you more kind of descriptions about our day, because I think it is important to you as advocates to know that although we talk about the hearings being suspended and the policy rules that we all kind of live under are not in effect right now, what is really important is that you should always remind us that you're there. We have heard, and the media has done a great role in kind of talking about, like, what's going to happen to our state budget, what's happening with our surplus budget, as an example. And sometimes I think it discourages folks to call and say, hey, don't forget about us, or we need to pay attention to this budget area anyway, regardless of COVID-19. Because I think it's really important. I have noticed that many advocates have stopped calling about their individual needs and have said, well, we've heard that if it's not COVID-19 related, it's not going to happen this year. Although it's true that our budget and our policymaking will be incredibly strained by the crisis that we're currently under, we realize that there's so much that still needs to happen, that still needs to be taken care of, and very vulnerable folks out there that still need our help, even if it's not COVID-19 related. When we started out this year, many of us had so many wonderful ideas about what to do with the fact that we had a governor, for example, that was willing to spend some of our rainy day money or some on some of these things that we really needed to spend money on, and to really pay attention to this policy area for individuals with developmental disabilities. And what has happened now is, as the money has quickly evaporated, we've kind of started to think, okay, we're not going to be able to get to do those things anymore. But I encourage you to still keep calling, keep doing what you're doing, keep reminding us that you're there, because we don't know. We really don't know how our things are going to end up, and some of those budget decisions are going to need to be made after all. As things are changing every day when it comes to this crisis. So in terms of the requests that come in. Assemblymember James Ramos sits on sub 1, which is the Health Budget Committee. So we will see many of the budget requests that are particularly of interest to the IDD community. And I want to say that it's been made clear by many advocates, thank you, that any kind of budget revisions, any kind of budget changes that happen, reductions, that families of IDD and individuals living with developmental disorders should be held harmless, and that their budgets be held harmless, and that is resonated with many. So I want you to keep staying involved so that we can remember these requests that we've made. PPE, as we all know, we keep hearing about this, is a challenge in the state, and that is also another priority for Budget Sub 1 to ensure that the most vulnerable individuals that need PPE get it, and that we supply it. And there's lots of opportunities for California, including producing its own PPE that's currently coming from other countries and being purchased that way. So there's many opportunities there. We have, as far as the Assembly members' legislation and the work that we're continuing to do, prior to the COVID-19 crisis, we had been working on prioritizing critical response in terms of suicide prevention and intervention. We're continuing down that path, probably more than ever, fueled by the recent request by many who work in the space to say that this is a crisis. It's continued to rise, and it's only getting worse because of COVID-19 in some cases. Not as many people are rushing to the emergency room when they're having a mental health crisis. And so they're going it alone. And again, we talked about the lack of prescriptions, access to prescriptions. And so it's tragic that during this crisis, we also see other types of loss of human loss, not just related to COVID-19 specifically, directly, but also through this other very tragic way, the rise in suicides. So we will continue to champion that. In terms of how you all can continue to weigh in, besides calling your individual legislators, I would say you should also call the California, the budget offices, both the Assembly and the Senate, because they too are open to the public and they too are looking to speak to people. You trust me when I say that you could probably get through if you do call, because not a lot of people are calling. So please take advantage of that. We're very much still taking public comment. So if you're sending emails, if you're sending letters, we are reviewing them. That is a lifeline for us. We do look at those. So please don't stop. And in terms of when we will return, we too are returning on May 4th, but with only essential staff. So at this point, like in our office, it's just the Assembly member and myself. There's a lot of controversy about whether or not we'll be tested before we come back and all that kind of stuff. So that all is still getting worked out, because although the state capital belongs to the state, it also belongs or lives in the county of Sacramento, and county public health department does get to weigh in on how we return to work. So that's it, and I'm happy to take any questions.
Thank you so much, Adriana. So much good information. So I would like to open it up now again for questions for Adriana. So feel free to type those in, and I can, relay those to Adriana. We have a couple, so I can get us started while you do that. So one question that was brought up is sort of a follow-up. Adriana, you had talked about when the budgets were being made that you've heard a lot from the constituents right now, families with IDD affected by ASD, all of that. You had said that you wanted the folks to be held harmless, right, for plans for budget moving forward. Did you mean that you want to see no reductions in budget for services for these people? Can you clarify?
Yeah, so at this point, we're looking at it that way, right? The no reductions part, understanding that there's been a need for a very, very long time to make budget adjustments to improve the budget in those areas for sure. I would say I want to encourage people to still push for that because a lot is changing day to day in terms of where we hear we're committing dollars. So although I know we all started with the premise that we would not be adding to the state budget unless it was COVID-19 related, I think it is still worth everyone's while to continue to push for increases. Although when I talk about being held harmless, I mean the other way, no reductions. At the minimum, no reductions.
That's good. We don't want reductions, that's for sure. Let's see. Okay, so keep typing away. Another question is also in relation to what you had said. I know that with the different timelines, you said some of the things are pushed back, that the legislative deadlines have been suspended. So the question is, how will you determine what legislation to move forward this year and what to move to next year?
So we've all received a directive from the committees that hear, the policy committees that are hearing these bills, to really kind of pare down our legislation, to look at, to look at it through the COVID-19 related lens, so as to see if it doesn't relate to that, then perhaps it's something that could wait for next year. So you can imagine that is a huge ask, because there's other things that are obviously needed in the state. And so to say, if it's not COVID-19 related, it's not going to happen this year. Although it is really kind of, I should say, it is something that we're dealing with every day. As we look at our legislation, we are trying to pare it down. We are trying to be understanding of the fact that we'll have a very, very short window of opportunity to move legislation along. So we're all doing the same thing. So all, if you will, all 80 assembly offices as we speak are doing the same thing. And then unlike other years where there's extensive policy hearings and lots of opportunity for debate and opportunity to shape policy, we've been told that at the moment, each policy committee will only have one hearing. And so that's what I mean by a very truncated process.
Yeah, you guys have a lot of work ahead of you. I will thank you in advance and everything you're doing right now. Okay, great. I'm going to give folks more time to type in some questions. I'm wondering if you notice I disappeared for like 10 seconds earlier. Everyone disappeared off my screen. I was having some tech difficulties. So I'm wondering either if Elaine's able to pull up the slide about a disclaimer. If you are able to, great. Otherwise, that's okay. What I had wanted to do was thank you for pulling that up, Elaine. So I had just wanted to spend like 30 seconds to remind folks that most of you are from the Linn training program. And as you know, because I've said it a million times, so thank you for tolerating my nagging, but Linn, we're not allowed to do any lobbying activities, meaning because we're federally funded, we cannot represent the university, we can't represent the Linn training program, and do any lobbying work. However, that doesn't mean this information that you're getting today or the policy curriculum that we've been, working on all year round, that information is not relevant for you because, one, you're always going to be a private citizen, right? So moving forward, that's hopefully this information will help you to do that. Even beyond graduation from Linn. But also you are welcome to speak as a private citizen at any time. So if you are interested and able to do any advocacy work, when you send, when you call legislative offices, when you send emails to your legislators, please do that using your private emails. That is highly encouraged because you are also experts in your field. So I just wanted to throw that reminder out there. anyway, so great. Thank you for putting up with that little disclaimer. All right, so I'm going to continue to open back up for questions. So feel free to send them in. Okay, and so feel free to send questions for both Robyn and Adriana right now. I'm just going to look through my chat box here. Okay, here is one. How would the special education waivers be in line with the requirements of FAPE, free and FAP? And I'll let either one of you take that.
Hi. So I think, obviously, again, this comes with the caveat of not knowing what Secretary DeVos's waivers are going to be at this time. But what I can say is, you know, hearing from school districts and from special education administrators throughout districts in California, their specific kind of requests for waivers have been narrow, very narrow in scope, and they've tried to keep it so that the things that they're asking for really are focusing on things such as timelines for things that just can't happen during a teleconference or over the phone or things like that. And so, you know, I'm hopeful that though, you know, with that in mind, with I think the majority of what districts have been asking for in terms of waivers have been very narrow in scope, and with, you know, a specific timeline end date and things like that. I'm hoping that what Secretary DeVos comes back with is in line with that. But again, you know, these all waivers will need to be passed into legislation by Congress, and so I think that, you know, that is providing one more support in there and one more you know, advocacy road so that all provisions of FAPE are intact, and it's really about kind of timeline flexibility and paperwork types of things, I think is what the ultimate hope is. So again, I wish I could provide more information, but, you know, we're still waiting with bated breath to hear what those waivers are going to be. So
thanks, Robyn. Adriana, I don't know if you wanted to jump in on that. Okay. All right, let me bring up another question. Let's see. Recent news articles mention some frustration of some legislators over lack of information when executive orders are issued, and legislators want a greater role in non-emergency decisions. What are you hearing?
So I think for the legislature and with the governor's executive orders, I mean, we are in. This is essentially what happens during an emergency, and it also is something that works, right? If you imagine every decision the governor had to make had to have sign off from the legislature, there's a lot of things that wouldn't have happened. However, as we get ready to come back from this crisis, as we get ready to reopen the state, there is a need for that. For all of government to be involved in these decision making, because inadvertently things get left out. And this is what we were talking about before when we were talking about the state budget, and as it gets crafted, that voices do need to be heard. And the legislature represents that constituency, right? Where there's the a statewide representation that and voice that is needed, albeit as a surrogate to their own constituency. But if we kind of shut that off, we oftentimes are getting decisions that are made that, again, may not be workable, or that are not the priority of the rest of the state. So there is a lot of frustration. That is true. While at the same time, there's a recognition and an understanding that it's what needs to happen in a time of crisis, so that things can happen quickly. But now we're at a point where I think it's where we recognize that there's a point where we do need to have the legislature back. Certainly, constitutionally, it is required, like I said before, for any more spending of the state budget. There is a budget that needs to pass on June 30th. So that goes without saying that there will be that is a legislative process and a function of the legislature. And so that's one deadline that you'll see us back for sure.
Oh, budget. Fun. Great, thanks for questions, everyone. I have another one here. How much attention are legislators paying to social media, direct emails, petitions, and other sources of communication from constituents right now compared to pre-COVID times? And I know we've heard from Adriana and Robyn how effective it is to make those phone calls and to continue to send those letters. But I think this question, you know, if we're all kind of at low bandwidth right now, right? We can only do so much. So if we're coming from this as a bang for your buck, you know, what is most effective for us in terms of doing effective advocacy and getting our legislators' attention?
Yeah, I could start, Robyn, if you want.
Yeah, go.
Yeah, but for us, it's very important. For us, we are listening to it. We are a part of it as well. Virtual meetings and social media and all of it have become very much our lives. It is, I'm going to say it's the lifeline, our connection to our constituents. They operate that way. The traffic on our Facebook pages, our state Facebook, our state website is tremendous. We look at it. We pay attention. Emails that come in through our public account. We also divvy it up between all of our staff. Something we didn't used to do too much before, we are definitely doing now. We feel a need to respond to each and every one. So I think it's incredibly important, and it's a great platform.
Thanks.
Absolutely. I think, you know, to echo that, it is hugely important. And I think, you know, we have had more hands on deck and people that have never really learned or done mail before being trained on how to do this, because we have seen such an increase in the amount of emails and comments and things like that coming in. And so, you know, I mean, every day the senator gets information on the things that the specific topics and issues that people are calling in and writing in about. And so it really is crucially important. And I think that it's a nice way, I think also that we've been able to build a stronger connection with our state offices in California. You know, obviously we always have connections with them, but it's a way that I think this has brought us a little bit closer with them in ways that I think if for no other reason than a 3,000-mile divide, you know, we are definitely separated physically from the California offices. I still think that the less social media ways, while we put out a lot of information that I think is great for people to access as far as, you know, getting information on our social media, I think in trying to contact us, not necessarily the most direct way, if for no other reason than just the way that offices are divided. You have a communications team that's kind of handling a lot of the front lines of getting in the social media stuff as opposed to some of the policy people. And so again, kind of trying to limit the number of people things have to go through for both timeliness and then also just bandwidth. I think it's definitely more effective to be able to get through the source. And so often that is either through a direct email or even through the online online portal where you can put emails in, because every portfolio has, you know, a person who works on that policy that's going through the mail and seeing, you know, what specific people are asking about and what is important to the people in California. So.
Great. That's good to know, because I know with Linn program we are often pushing out information and options for folks to communicate with their legislators, and we often will get great information from advocacy groups with sample language that they can use. So I'm wondering if I can personally ask, when you get emails, and I've sent these myself to a legislator, and you kind of copy and paste the language that's suggested from different groups, do you just kind of ignore those because, yeah, we've heard this template, or is it still worth doing that?
Yes and no. In a purely logistical sense, the way that with a state the size of California and the fact that we receive close to 300,000 pieces of mail a week that we are sifting through, so when language is exactly the same, it can get lumped into what we call, like in our mail system, a campaign finder, where it basically flags emails that are all exactly the same. And hopeful for efficiency on our end, as far as when we're flagging things that are and putting things into specific categories and kind of saying, all right, X, Y, and Z are what people in the education community are talking about this week. It's hopeful for that. I will say that. Not that it gets less attention, but that because it does get put into those big buckets, sometimes, it's looking at it as a whole. So you've got kind of a little bit of a double-edged sword where it is getting put into one big bucket. If you have 700 emails that came in all with the same thing, so it might not be someone is reading through every single one of the same exact email. But if you have 700 emails that came in about one specific topic, the fact that you had that number coming in that were exactly the same is something that will get flagged as kind of a top line and saying, all right, this is something that's coming in. So again, useful if it's in large numbers, and it can be impactful when it stands out from the amount of, from the numbers of mail that we're getting, but sometimes hard if we're, it's getting lumped into this category that we can flag as saying, all right, this is in this category and is getting this response, in the 200,000 pieces of mail we go through a week.
Yeah, that makes sense. Thank you for that honest answer,
yeah.
Adriana.
Say the same thing. I do think we do pay particular attention when it is coming from a constituent. However, I think that's important to keep that relationship going, to know who your legislator is and communicate with that office specifically. Because the mail we don't listen to, we listen to all mail, I take that back, but the mail that is noisy, I would say, is if it's just a piece of mail that lots of folks have signed on to and they're not from the district, then it does get categorized in a different way. So that would be the one thing, just to make sure you know who your legislator is, who represents you, and so be much more targeted in where you send that mail.
Fantastic, thank you. I've always wanted to ask someone that. Okay, great. I have a question for Robyn. Is most of COVID response being done by executive order or legislation? It's hard to tell sometimes.
Yeah, that's a great question. I would say that it is the top line is being done legislatively, but the specific way that legislation needs to be carried out is then being done by rulemaking by whoever the executive of that agency is that's heading it up. So, the lawmakers are saying there are going to be X, Y, and Z things put into place, but then that bounces over to the agency, and they're the ones who actually have to say, all right, what is the what are the specific steps in getting those things done? And sometimes I think that having to go from the legislature to the agencies is where we've seen a lot of confusion, and where we've seen a lot of, we're kind of, people are waiting for rules to come out or directives to come out from the agency because they can't make those specific steps, or they can't, dole out funding, for example, until they get more clarification from these rulemaking, especially if it's an unprecedented time, like everything that we're doing right now in COVID is. There's always this worry that we are going to do something that is incorrect, So I think that's a lot of the delay and a lot of the backlog is because you've got the legislature saying you're going to do this, but then the agency and the executive need to figure out how that's going to be done.
Great. Let's see, looks like I got a new question. So I'm going to ask one more question, but feel free to type in some more. If we have some time at the end, we'll try to get to those. Since I just got this one from Ryan, I'll throw this one out there. As a result of the COVID-19, what adjustments and preparations have you seen and heard that are being made for the year's remaining elections to be more accessible and inclusive for people with neurodevelopmental disabilities?
Yeah, that's a really great question, Ryan. I think right now Senator Harris last week released her Vote Safe Act, which is trying to ensure that that people are able to vote safely by mail and early voting, and giving much longer timeframes and windows so that people are able to adjust voting and things that they need to their own schedules. Voting is not necessarily within my my specific portfolio, and while anything that they are doing in that space, they would come to our group for the work with disabilities. We haven't really seen a ton being discussed, so we would be really really happy and open to hearing from you what you think some of those really important steps are to make sure that voting is as inclusive as possible for everybody, and making sure everybody has that right. So yeah, we would be really happy to hear some suggestions or priorities.
I would echo that for us as well here at the state and the legislature. We're open to that, of course. And I think I've not heard a lot in terms specifically about any changes coming soon. But we're in the middle of census as well, which is also equally important in terms of making that accessible to all. Our Assemblymember Ramos does have an elections bill that has to do with the Indian Nation in California and the tribes that oftentimes have a hard time getting to a ballot box. So we're actually have legislation that is sponsored by the Secretary of State that would bring ballot boxes to reservations. So I do think that and that's a priority for my boss, obviously, since he lives on a reservation and grew up on a reservation. But I do think that we live in a state that is very welcoming to ideas about how to make elections more accessible to all. So if anybody has any ideas, we'd love to hear those.
That's great. Thank you both for that information. And thank you everyone for the great questions. I do want to move us along just to respect time. I'm going to give Elaine the mic to talk about what the next steps are.
Thank you so much, Robyn and Adriana. This has probably been one of the best discussions I think that I've seen in a long time, just being able to ask those questions and have you share how things have changed. We really appreciate you taking the time, and I'm now filled with ideas that we can look at for Family Voices of California and how to get our families engaged with their legislators as we move forward. So we will now move into talking about sort of the current issues and environment that are facing people with disabilities. We're facing some really conflicting situations. We've got urgent needs and competing demands. We're weighing public health and individual health, paying bills, getting services, needed equipment. Those sorts of things are all sort of competing with one another and conflicting, and emotions are running high. We've got a lot of sweeping proposals and policies that are impacting pretty much every part of our lives under these compressed timelines with little to no time for public review. And sometimes it's even hard to find out where something is in its respective process. We've got some ethical questions. The COVID crisis guidelines prioritizing who gets care if our system becomes overwhelmed, and those with disabilities. And there was a big effort by advocates in California. 60 advocates came together to respond to the guidelines that California put out. And good news, the governor put a draft on those guidelines, and they have committed to looking at them again, because people with disabilities were really at the bottom of that priority list, very specifically called out. So it's just a lot of change and things that people are really trying to weigh. There's a lot at risk for people with disabilities, their families, and those who serve them. These shifting priorities make it critical to ensure people with disabilities are protected. We hear a lot of, this is an unprecedented time, to explain the limitations. But decisions that are made now can really become part of our cultural consciousness, possibly continuing after the crisis subsides or is over. We know there are a lot of existing disparities, and those we're already seeing them widen, and we may see them widen even further. We've got legal ambiguity in education, healthcare, and rights there's concern over threatened rights for people with disabilities, and the budget decisions are likely to cause even more distress on an already strained system. So it's great to hear from Adriana that there is some support around a hold harmless concept where people are hopefully not going to see these reductions in the services that they receive. We have an opportunity to take advantage of this new willingness to be flexible and creative. People are seeing that when we all put our heads together and come up with some fresh ideas, that things are actually, that we never thought possible, can work. This is an unprecedented time, can work both ways. So what's interesting is people who may never have experienced some of those things that those with disabilities have lived with are experiencing them now. And so they're able to get a little better understanding. When Adriana mentioned just picking up a prescription, it's those types of things that many families who have loved ones with medical fragility who are isolated at home or have been for a very long time, or those who may have a lot of disruptive behaviors and can't go and pick up things and go to the store. I used to give the example of the families that Family Voices of California works with, as though they couldn't even get out to the supermarket many times. And now everybody kind of understands what that means. So there's a lot more empathy, I think, for the issues that families and professionals serving people with disabilities are dealing with. Everybody is now experiencing these deficiencies in education that were previously shouldered really by parents of kids needing supports and modifications. Another opportunity is the Capitol, the policy staff are getting much more exposure to constituents, and they're really beginning to, or much more, I should say, see how some of these policies are playing out in real life. So much policy making is happening so quickly, and often by executive order. These are things that impact people with disabilities and those who love and serve them now and in the long term. Even if there are end dates on some of these things, there are going to be long-term ramifications. We heard from Robyn and Adriana about the opportunities and the importance of advocacy right now. Of course, with all these competing demands on our time and energy, finding even a spare minute can seem impossible, especially for those who are juggling the demands of work and caregiving and homeschooling and all these other things that are coming into play. But if not us, then who? And if not now, then when? If we don't do it, other demands will take precedence. We must do it now as these policies are proposed. We really need to weigh in. So we know that policymaking is changing. It's gone through some changes. We're going to see more changes as Congress and the state legislature begin to have more of a presence back in person at the office. Our advocacy has to change with it. We've got this new environment and we've got these new opportunities, and in talking to staffers, and obviously we heard from Robyn and Adriana, this is an excellent time to reach out. Don't be afraid to reach out. This is a really great time to build those relationships that we've talked about building in the past. It's hugely important for the future advocacy that we want to do. And now that folks seem to have maybe a little more focus on constituents, a little more time and flexibility to be able to spend that time, what a great opportunity to set up a call, talk for 15, 20 minutes, ask some of the questions that were asked today about what's going on in their offices. And you can really begin to build those relationships, get to know folks. You may find that you have more in common now than ever before because people are taking the time to check in with each other at the beginning of calls. How is this affecting you? How are you doing? How is your family? More so than has really happened in the past. Ask for help, ask for information from legislative staffers. I spoke with one staffer who told me he's now able to do things he didn't have time before, like follow up with a local decision maker at a school district on a constituent problem and concern. He at the Capitol office didn't have time to get in at that level of detail, but now he just may have that time. And so if someone were to ask, he could maybe send an email following up on that sort of a thing. A lot of bills are going to be carried over to next year. So just even if there's an issue that you were watching or interested in, trying to get a handle on what's going to be moving forward this year, what may be pushed off until next year. And it may be the only way to find out what's really happening with legislation. And Adriana said, we need to hear what's working, what's not working, how things are impacting. So it's really important that we try and take those minutes or two that we can possibly find. If you can, do. And if you can't, ask others. We have some people are so much more overwhelmed than ever before. And then there are others who are getting a bit of a break. And we can be champions and we can tap into those folks that care about our families and us as professionals or our colleagues who may have that extra time and can weigh in. Looking to those friends and family members who may not have so many added pressures maybe we can begin to ask them, and then in the long run, it gets them more involved in the advocacy on issues that we care about. Don't be afraid to ask for things and to share your story, of course, to bring those issues to life. Those provider stories, those are really important, and those family stories are really important. Thinking about just an example of a provider, say, who's worried about regression in a patient and maybe has now heard from a parent about an injury due to behavior. For example, I know one mom who was reporting that her son had such disruptive behaviors and didn't have the behavior support from school anymore. He broke a window and injured himself pretty badly. And now they have a broken window and they've got other kids in the house. And these are things that really paint a picture of what the impact of something can be, such as not having those behavioral supports. So there are those really good stories that you can tell. We all have those stories. The more personal, the better. Parents can talk about the impact on their family, on their children. Professionals can really better see trends because you're working with more families. General impact across the group. If you're now able to do telehealth video visits, how's that working? Is it working really well? Are parents concerned about it? Are there things that are advantageous or the things that are missing? Because there's been a lot of challenges in reimbursement, for example, payment for video visits, but now everybody's doing them. And so this is one of those things that may provide some carryover for some policy change in the future. Follow up if you're concerned or pleased with something, let them know. Advisors can't share concerns with their bosses if they don't know about them. So if we're not saying anything, then everybody who's working on these issues figures that things are probably okay the way they are. So everybody has 5 minutes. There's something that everybody can do. The quickest and easiest way to stay updated is to sign up for newsletters from trusted sources. And I've talked with this group about that before. Find those sources that resonate with you, those groups that you agree with, sign up for their newsletter. At very least, you can read their headlines and have a sense of some things that may be going on. They do those action alerts, and they usually provide a link with sample language. And we heard today that that's fine if you're sending in something that's more of a template, but better yet, personalize it. Add in that one paragraph about why you care about this particular issue. So even if you can't respond to these action alerts, it's a really quick way to just stay updated when you're getting a weekly newsletter from folks. Choose those issues you care about, those that are closest to home, because those are the ones that you're going to be able to share stories about. And try to make a commitment to do something, even if it's just for 5 minutes, because your 5 minutes will make a difference. We see it time and time again. People don't think that their single voice makes a difference, but it really does. And it's important to be part of that if you care about something. So just to give you an example of something that I was recently involved with, our school district community advisory committee is something that I serve on. And as soon as schools were closed, I contacted our special education director, who's also our SELPA director, and said, hey, can the community advisory committee be involved as you begin to look at policies and practices? We know we're going to move to some alternative form of education. And I heard nothing. So I contacted her again, and this is someone that I know and have a relationship with. And I knew she was busy, so I didn't necessarily expect a quick turnaround. But about a week or two went by, and I contacted her again, and she did respond, but didn't. It was just sort of a got your note, thanks so much sort of a thing. And already there was a lot of grumbling about things. Our district had sent out a prior written notice that all related services, speech, occupational therapy, all of those related things were going to be provided on a consultative model. So now parents were getting links to videos and worksheets. Well, when you're trying to work on articulation, or you're trying to work on social skills in interacting with peers, videos and worksheets don't really go a long way. And so there was a lot of concern over lack of accessibility. I happened to see that a school board member was holding a call. And so I decided to get on the call. It took me about 15 minutes to prepare. I was going to give a brief comment. A couple of us from our board participated, and we asked about how are you engaging families? You should be engaging families. They can be really innovative, test ideas. The call was an hour long, and an interesting response. One of the board members said, well, I think we do have a lot of community advisory committees, and we should ask the superintendent how we can engage them. A couple days later, I get a note that there's going to be a community advisory committee meeting, who can attend. That was a total of an hour and a half of my time. So more than maybe some have, but it wasn't a terrible amount of time. And now hopefully we can see some family engagement on this issue so that maybe there will be less frustration moving forward. So I just wanted to provide some ways to get in touch with your elected officials and sources for information that I use. This is not an endorsement by Linn or Family Voices of California. These are just some organizations that I rely on, some that I thought of. If you can't find something on an elected official's website, call or email them. And they have more time now, so hopefully you'll be able to get through a little quicker. If you can't find something on an agency's website, call or email your representatives, and maybe they can help get through to that agency. So that is all I have. We do have time for more questions if there are any more. Kelly, do you want to?
Yeah, I'm happy to help.
Those?
Yeah, I'm just going to make sure that I have give time to folks to type if they want to. Thanks, Amy. Yeah, I got a thank you from Amy. I think I can speak for probably all of us that it's just been really informative, so much wonderful information. And Elaine has offered that we can have these slides after we're done today. So all those great resources that she put up on there, you'll have access to those. So don't feel like you have to write everything down. Yep, she even shared her info. So we can all bug her with questions. Okay, that's great. Elaine, do you want to take, let me see, we're in our last few minutes and I'm not hearing any new questions. So maybe then I can just end by saying thank you to all our great speakers, Elaine and Robyn and Adriana. It's so rare for us to be able to get a glimpse and get the expertise and hear the wisdom of folks who are kind of in the trenches. So I'm so appreciative that you were willing to spend the time to share all this information. It is fantastic. We're going to share this information, like I said, with the slides, but also the recording if folks are interested in viewing it later. I know there was a lot of information to digest, so I want to watch it again as well. Yeah, so Elaine, if folks want to have follow-up questions that they think of later, would it be okay for them to email you?
Yes, absolutely.
Okay.
And if you have any questions for Adriana or for Robyn, either you or I, Kelly, can share those on as well.
Absolutely. Okay, well, for the Linn trainees who are in the NorCal Linn trainee, I sent out a evaluation link. I'll resend that out again, but it would be helpful for us if you could fill that out. You know the drill. Okay, well, thank you so much, everybody, and thank you for participating. I think we had a really great turnout. Yeah, have a great rest of your day, great rest of the week. This is a great way to start a Monday, so thanks so much.
Thank you.
Thank you.
Bye-bye.
Thank you. Bye-bye.